There is nothing more annoying than coming into a shift and going on a cart and a cart is not stocked, not ready for the next nurse. So in this video, I'm gonna show you what your cart should look like. Let's get it.
But you can live pretty well by yourself.
So this is proper nurse etiquette. One of the first things that my preceptor taught me when I got into it on my first LPN job was to always make sure your cart was straight for the oncoming shift, for the oncoming nurse on the shift. So I'm going to give you a quick idea of what your cart should probably look like. Now, I'm not going to open the drawers because there's medication and you got people's names inside it, but I'm just going to say that it should be organized. Make sure it's organized. Make sure, you got new meds stocked. Make sure you don't leave empty cards in the cart. Like, that is so annoying. Don't be that nurse. And I know it's probably going to happen anyway because everybody does it. Even I do it sometimes, and sometimes you just forget, especially if you got a heavy pass, but just avoid it. Don't be that nurse. Leaving an empty cart in the cart is by far one of the most annoying things you could possibly do. So let's just talk about how your cart should look. Now, for the sake of HIPAA, I'm not going to show the computer because obviously, it is what it is. But I'm just going to give you an idea on how the cart should actually look. So that's my silent night. This is my NARC book. Make sure your NARCs are all signed out, and make sure you sign your NARCs out as you go. This is the silent night. This is what you use to crush medication. I'll wipe all that down. I already wiped all this down, but it's cool to make sure that you wipe stuff down, to help keep germs down. Look at that fresh, sexy ice water. Yes, sir. That's some nice old ice water right there. Ladies and gentlemen, make sure that you keep a nice ice water there. You know what I'm saying? Make sure that the residents want some cold water. Make sure they get some cold water with their pills and stuff like that, unless an order says otherwise. So make sure they got that. See, we got that young applesauce now. Who can tell me what I did not do? I'm gonna give you a couple seconds. 3, 2, 1. This is just for demonstration, but be better than me. But I did not date the applesauce, nor did I date the water. You should always date the water of the current date and the time. So make sure you do that. Make sure you always do that. Got a clean surface. Make sure it's clean. I just wiped it down and everything like that. This is obviously, the computer part and all that. Make sure you got your spoons. Make sure you got your straws. Make sure you got your cups, your med cups, and the cups for water. And please have an empty trash can. Now, it's just a couple rubber bands and my cleaning cloth in there, but you don't want a full trash can. And you always want to make sure your drawer is locked. Your drawer is locked. So you always want to make sure it's locked. And that is proper cart etiquette. Now, some people are going to say, oh, it's not a big deal. It's not a big deal. And, eventually as you continue to work in long-term care, it'll just become second nature. But you'll be surprised how much people actually do appreciate a stock cart. I know I appreciate a stock cart and a wipe down cart and everything like that. I really appreciate it. I don't take it for granted. I thank the nurse every single time. So, yeah, that's this video. So, this is just some new nurse game for any LPNs who about to start their first job, or any LPNs who, you just graduated from nursing school, you finna take your first nursing home job, and you may be watching this the day or the week before you start your gig. You always want to make sure that you have a ready to go cart. Make sure your cart is stocked. Make sure everything is good, ready to go for the next shift. Make sure all your NARCs are signed out. Make sure your charting's done. And your life's going to be easier. You're making the next person's life a little bit easier. Try not to leave any empty cards inside of the cart. Make sure like your diabetic tools are in here, stocked and organized. Like I said, I didn't show the inside because we got people's names and stuff like that on these medications and these insulins and stuff like that. But just make sure your medications, you make sure your insulin, your glucometer is wiped off, and make sure you got your glucose strips and your needles and all that stuff. Make sure you got your alcohol wipes. Make sure you got all that stuff in here. And maybe later on I'll do more like an in-depth where I can take some of the meds out so you can see, how it's supposed to look as it's organized. Don't forget, make sure you date your applesauce or your pudding, whatever you want to use, and make sure that you also date your water, because the state gonna come in and they're gonna look at that kind of stuff. Now, I didn't do it right now because I just forgot, but I will for the next nurse. So yeah, anyway, ladies and gentlemen, so let me know what you think of this video, and if you like it, hit that like, comment, subscribe, and I'll let y'all in a minute. Peace.